we're going to empower you with the knowledge, because remember, there are a lot of different things that set the stage for painful sex. So something called vestibulodynia is one of them. I'm going to introduce you to the Q-tip test. This is a test, honestly, that most physicians really don't know how to perform. Really walking through, identifying if this area has inflammation, irritation, is going to be super important to get you the right type of treatment and truly understand the diagnosis that you're dealing with. All right, coming in hot for the Q-tip test. So you're gonna take your Q-tip, and you can use just a little bit of water or your favorite lubricant. And I want you to identify the labia minora and gently pull it back. So we're gonna use the reference of a clock. We're gonna say 12 o'clock is up towards the pubic bone again, 6 o'clock down towards the perineum. We've got at the top the glans clitoris, okay, the urethral opening right here, and then going into the vaginal canal. The vestibule surrounds all of those structures. So I want you to start down at 6 and take your Q-tip gently, come right onto the vestibular tissues. You're not in the vaginal canal, you're just inside the labia minora, above the perineum, and gently swab, lightly. You're not using a lot of pressure. And I want you to note if you have any pain here. If you do have pain, just note if that's a burning pain. Is it sharp? Is it bruisey? And each one of those descriptors means something different. Okay, so right now we're going to map this out. You start at 6, gently go over towards 7. We're going to come through 8, 9. You're on that vestibular tissue inside the labia minora. You're coming up a little bit closer now, right outside the urethral opening. Note if that creates any burning or irritation there with the vestibular tissue. Come right above that. Okay, so now we're headed up towards 10, 11, and even 12 o'clock. Okay, we're gonna do the same thing on the other side. Come down 1 and 2. Okay, we're gonna be, again, next to that urethral opening. Okay, 3, 4, 5, back down to 6. Let's talk about key takeaways from the Q-tip test. We're looking at the vestibule in through here, and if you find and explore that you have irritation, burning, sensitivity anywhere on the clock through that entire vestibule, remember that this vestibule is dependent on both estrogen and testosterone, and we can get hormones applied in through this region to help it become more healthy. If estrogen and testosterone use is not enough, we then look at potentially nerve proliferation in through there, or we look at the muscles outside of the vulvar tissues, the superficial pelvic floor, as being a contributing factor to pain through this region.